A 55-year-old man comes to the office because of feeling thirsty and frequent urination for 1 week. Medical history includes a self-diagnosed upper respiratory tract infection 2 weeks ago, for which he took a medication that was originally prescribed for his acne 30 years ago. Examination shows dry mucous membranes. Digital rectal examination shows a normal-sized prostate. Laboratory tests show hypokalemia and acidosis. Urinalysis shows elevated glucose, protein, calcium, and phosphate. Which of the following is the most likely long-term complication of this patient's condition? A. Osteomalacia. B. Osteopetrosis. C. Retinopathy. D. Rickets. Or E. Spinal metastases. The answer here is A. Osteomalacia. Before we look at the major takeaway and main explanation, let's think about why the other choices were wrong. First, osteopetrosis. Osteopetrosis, literally stone bone, is an extremely rare inherited disorder whereby the bones harden, becoming denser. Mild osteopetrosis may cause no symptoms. However, serious forms can result in stunted growth, deformity, and increased likelihood of fractures. Patients may also suffer anemia, recurrent infections, and hepatosplenomegaly due to bone expansion leading to bone marrow narrowing and extramedullary hematopoiesis. C. Retinopathy. Diabetes mellitus can cause polyuria and polydipsia. Long-term complications of diabetes mellitus are microvascular, retinopathy, peripheral neuropathy, and nephropathy, and macrovascular, cerebrovascular disease, ischemic heart disease, and peripheral vascular disease. Diabetes mellitus is not caused by the use of expired tetracycline medications. D. Rickets. Rickets is defective mineralization or calcification of bones before epiphyseal closure due to deficiency or impaired metabolism of vitamin D, phosphorus, or calcium, potentially leading to fractures and deformity. Fanconi syndrome can cause rickets in children, but this patient has completed development, meaning their epiphyseal plates have closed. E. Spinal metastases. Prostate cancer can result in polyuria because of compression of the urethra and impaired urodynamics. Prostate cancer most commonly metastasizes to the spine. However, this patient also has polydipsia and a normal digital rectal examination, making this diagnosis less likely. Now let's look at the major takeaway. Fanconi syndrome may be caused by expired tetracycline medications. It leads to defective transport of certain substrates in the proximal tubule of the kidney, including glucose, amino acids, sodium, potassium, phosphate, uric acid, and bicarbonate. And the main explanation. Seeking relief from the flu, this patient self-medicated with tetracycline, which was originally prescribed for his acne vulgaris many years ago. Expired tetracycline is a known cause of Fanconi syndrome, a hereditary or acquired disorder of the proximal tubule of the kidney. Fanconi syndrome leads to defective transport of certain substrates, including glucose, amino acids, sodium, potassium, phosphate, uric acid, and bicarbonate. Characteristic findings include glucosuria, phosphaturia, proteinuria, polyuria, dehydration, hypercalciuria, and hypokalemia. Bicarbonate wasting can lead to renal tubular acidosis, while phosphate wasting can disrupt vitamin D metabolism and bone mineralization. This can result in rickets or impaired growth in children, and osteomalacia, osteoporosis, and pathologic fractures in adults.